Hello, my name is Emily Jordan, and this is my PowerPoint in regards to epilepsy. Under the IDEA, it is under the category of other health impairments. So the definition of other health impairments according to the IDEA means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment that 1 is due to chronic or acute health problems such as asthma, attention deficit disorder, or attention deficit hyperactivity disorder, or ADHD. Diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, and Tourette syndrome. Or 2, it adversely affects a child's educational performance. Under the New Jersey Special Code of Education, it corresponds to chronically ill and means a disability characterized by having limited strength, vitality, or alertness, including a heightened alertness with respect to the educational environment due to pretty much all the same things under the IDEA, with an addition of hemophilia and 73 diabetes or any other medical condition. And it also affects the child's educational performance. And with documenting of the health problem with a medical assessment is required. The developmental characteristics that can be seen with epilepsy. There are no physical signs that you look at a person and you know they have epilepsy. However, some cognitive characteristics is that they tend to have issues with thinking and learning, mostly with attention, concentration, memory, organizational skills, academic achievement, and some kids will have a developmental delay due to the extensive brain abnormalities. And because of this, they are at risk of developing speech and language problems. Some social differences are the child will miss academic, social, and recreational activities if they were to have a seizure and needed to be in the hospital. And when participating in normal school activities such as gym or recess, they have to be careful for their safety because they don't want to onset any seizures. So it can make the child feel socially isolated, and it leads to poor social skills and difficulty in social engagement with peers because they feel like they are different and their peers may see that they are being isolated and think that they are different as well. Emotionally, many children with epilepsy can be seen with anxiety, depression, irritability, hyperactivity, aggression, and in some cases, irrational periods of rage. This is especially seen before they are going to experience an epileptic episode. Physical problems, there can be issues with hormones that can cause reproductive problems later on in life, but epilepsy doesn't directly affect the bones, but some of the drugs that they can be taking to prevent the seizures are able to weaken their bones. Some strengths that people with epilepsy have are they're able to go on certain medications, and if they work properly, they won't have seizures anymore, so they can live a normal life. They become more conscious of their health and just how important it is to take care of it. So they have doctor's appointments regularly, which keeps them in tune with what's going on in their body and how the different drugs and everything is affecting them. And it educates them about their brain and their central nervous system so they can educate others. They have a much higher sense of compassion than other people because they understand that during rough times they greatly appreciate that compassion. So when others are having the rough times, they show compassion as well. They can also be very creative in finding new ways to prevent seizures, but it also is allowing a creative path for them in other ways of life. Some challenges that they may face are trying to feel normal, especially with their teachers and parents treating them as fragile. They must be careful while doing sports or other activities, but they do not want to be made to feel like they are different. Kids with left side of the brain seizures tend to have more difficulty with language problems, so they will get stuck on little details, they fantasy think, or they become extremely religious. Kids with the right side of the brain seizures have perception problems like not seeing details, letters, or words to which they will cause confusion. And they do not pay attention to how others feel because they will be very blunt in situations where other people without epilepsy tend to hold back. Some strategies that you can use as a future special education teacher, especially academically. You can break down tasks into smaller steps and will make it easier for the child to concentrate on just one part of the task rather than it as a whole. Frequent repetition of materials can help with improving the memory issues, and for those with language deficits, providing written directions instead of just oral is easier for the child to understand. Social strategies, it's important to make the child's experience as normal as possible. They should not be made to feel like they are inferior to their peers who do not have epilepsy. So do not make it a big deal to hand them written directions or to seat them closer to the board. Try to use extracurricular activities that don't exclude the child with epilepsy. So field trips where they're able to go on and they aren't held back from doing anything while on the trip. It will make the social interaction with peers a lot easier. The teacher should display a calm and open attitude and behavior in order to prevent long-lasting negative attitudes which the child can feel from peers and others, and it will make them feel more accepted. Then there are some resources. The Center for Disease Control and Prevention offers a program for epilepsy to improve care, communication, and combating stigma, having self-management, surveillance and prevention research. The Epilepsy Foundation provides education, advocacy, and other resources for people who are living with it. There's an app that tracks seizures so you can see how often, what kind, all that. 4 Paws for Ability is a resource to get a service dog, to be a seizure assistance dog. And then if you click the link below, there's a video educating people on the difference between a normal seizure and someone with epilepsy. Here are my references. Hope you enjoyed my video and thank you very much for watching.